So next is going to be Cecilia. She's going to come up and talk to us about nutrition, and I'm looking forward to it. And it's right before lunch, so we can make good choices. Come on up. Thank you.
Can you guys hear me? Oh, yes, I can hear me. Whew. Okay, so my name's Cecilia. I've been a registered nurse for over 30 years, and I recently finally got my degree, and I did it all in, as I mentioned earlier, I did it with a focus on metabolic health. My capstone project was on metabolic health, and that's what I'm really interested and passionate about because, well, just for, when I was a home health nurse and a case manager many years ago, I found it so frustrating that, that people had these chronic diseases and they were being medicated and they were trying to get help, but it oftentimes just didn't work. And I find this especially true when I was dealing with wounds on diabetic patients. And so to find out that there is a way of helping those patients was mind-blowing and so exciting to me that I just had to learn more and more and more. So that's kind of what my passion is, and so I'm really, really honored and happy to be here and to kind of share what I've been learning with you all. So my PowerPoint presentation didn't quite work, and there was just some things going on, and now I'm noticing that a lot of my notes are not showing up for whatever reason, so I'm just going to, maybe the Lord's will is that I present this way, so I'm going to take it as a sign. But so I one of the things I like to think about is that we're navigating this world, right? And I always think of how the enemy is active in it, and how the Bible calls Satan like the king of the air, right? And it just feels like you could see his hand in just about everything to kind of sabotage human thriving, because he doesn't like us, right? He doesn't want us to thrive. And so, and I see that so much in just the lies that we hear day in and day out about just different things, and so just like I remember, for example, I remember how there was what was it? It was like like self-love of no matter how big you are, no matter how large you are, right? And and I would look at that as a nurse, which I'm sure other healthcare professionals here were looking at that and thinking, that is a nightmare. It's a disaster to teach people that that's okay, because it's obviously a metabolic problem going on. And there's a lot more metabolic awareness now, and I love podcasts, and I listen to lots of them, and I've been following certain doctors and physicians that have been on this path, because like me, they noticed that health rates were getting worse. Chronic disease was going up. Cancer was going up. Diabetes is going up. And I had my statistics, but I think I can remember them. 46% of all Californians have diabetes. We know that people with diabetes have a higher likeliness of getting cancer, and we know that people with diabetes that are on insulin have even a higher possibility of getting cancer. So it's a really serious thing. So we can head that off early. That would really help. And even if you already are in that state of cancer, there are lots of things that you can do to tolerate therapies better, to tolerate chemotherapy better, and standard of care therapies better, and to strengthen the body functions that you do have in all your healthy cells through diet. So how did we get so far off course? I would say, well, a lot of my references would say that cancer is a disease of civilization, because there were a lot of studies from like 1800s to 1930 where these people would just go out of curiosity and live with the Inuit or the Native Americans or Aborigines that were far, far, far from civilization. And they noticed, and they looked for years and years and years, and noticed that there were just no cancer rates. And so that's not a causation, of course, but it is a correlation. And the nearer they would move into civilizations and be affected by Western diets, they would end up getting cancers and other chronic diseases. So what were the offenders have been shown to be just the things that are in all of our foods. So like 70% of the grocery store is full of these poisons and ingredients that you just look at a list and you're like, what is that? Like if you don't even know what it is, you probably shouldn't even be eating it. And so my aim, and I am trying to get another degree in metabolic health and become a practitioner for that, but I'm just in the journey of going through that. But I will share with you what I do know as I'm trying to do. But so a lot of the offending items in the grocery stores are in packaged foods. So if you could just buy things from the edges of the store and stay away from the middle, you'll do a lot better. I don't know if anybody here remembers how small the chip aisle was. It wasn't an aisle. The chip aisle, 30, 40, 50 years ago, there were a few little options. Now you have chip aisles and you have cracker aisles and you have all these packaged food aisles. And it's like, this cannot be okay for our metabolic health, as we have evidence of, because I think it's like something like 75% of Americans are overweight or obese. This is a disaster. This is not how we're meant to thrive. And so, let me see. Oh yeah, and then there's the food pyramid. That is way off, okay, because as I mentioned, the people who were not getting cancer, who were eating an ancestral diet, like let's just take the Inuits, they were eating tons of fat, like I think 90% fat, they were eating a little bit of protein, they were chewing on whale skin and whale fat, and they didn't get any cancers until they got closer and closer to civilization, where there were seed oils, refined flours, sugars, all these things that our bodies don't need. Like, there's okay, so like, let's just take a very fibrous bread, or grains. Let's just take grains. Grains are kind of, they obviously would occur, and they would be collected in agriculture before diabetes rates and chronic disease rates went up. But they have fiber. Fiber slows down the absorption of the glucose inside of the grains. It slows it down, so you don't get the huge sugar spike. Well, now with it being refined, you might as well have sugar. It's like having a little bit of unsweetened, powder sugar. That's what flour basically is, and we have it in all our breads. We have it in everything. They add sugar to everything. And so there is a very strong correlation between these refined products and all kinds of chronic diseases. Because what happens is those sugar spikes cause microvascular damage, basically, because your body's, of course, trying to compensate. Your body's trying to create insulin to open up the cells and hide that sugar, because it should not be in your circulation. It's kind of toxic in the circulation. It causes microvascular damage. Well, guess where microvascular veins are? Everywhere in your body. So it affects everything in your body, everything. And so I think that part of being healthier is to avoid seed oils, flours, refined foods, sugars, anything packaged, because you don't know even what's in there, right? And so that's not going to help you. And if you have cancer, you definitely need to be optimizing everything you can possibly optimize. And you can do that with highly dense nutrient food. And if you can't tolerate that, there are ways around that. And there are ways to get the nutrition you need around your therapies. Like if you're doing chemotherapy every day, you would fast at a certain time and start eating at a certain time to make it sure that you can tolerate it. But whatever you do, whether you have cancer, whether you have diabetes, whether you don't have any of those things, is avoid these foods of civilization that are just not even foods. So that's what I'm trying to say, and I hope that sticks a little bit. Let's see. Well, I can just go back to the history of food a little bit. Oh, we already talked about that. But then the food pyramid. Okay, so the food pyramid, right? It's got I think it's got the oils at the top, the fats at the top, and then down here they want you to have, like, I don't even know what it is, 300 grams a day of carbohydrates, breads, and, there are all those delicious pictures of the breads, and I would have showed you that, but I don't, I don't have it, I'm so sorry. But actually, you can just get rid of the bottom part. You don't need any of those things. They are not essential because your body has a mechanism called gluconeogenesis, where your body creates every bit of sugar that you need. Your liver's able to do that. You don't need to add it in. And I know this because to prepare for this, I got a blood glucose monitor, a continuous one, so that I can kind of encourage you all to get that, because that's ultimately what's going to teach you and show you how you're reacting to food. Like, it's really quite stunning to see what causes blood sugar spikes and what doesn't. And I'll tell you, I don't have a drop of carbs. I haven't had a drop of carbs for weeks, and I'm alive. You know what I'm saying? So, I mean, I am proof, and all of the other people in this space who are avoiding the carbs and the processed foods can tell you, you do not need added carbohydrates. You do not need added sugars. You can survive because your body has a mechanism to create just the right amount of sugar you need. Your central nervous system has something called astrocytes, and those specifically generate the right amount of sugar for your central nervous system. So, and it doesn't, your central nervous system prefers ketones, which are the products of fat metabolism. So what I want to say with that in mind, when do I have to stop? I'm sorry.
Go play some music.
Oh, okay. All right, very good. So then I'll start dancing. No. Okay, then. Let's see here. So let me go back a little bit to just kind of praying for wisdom and discernment. Trying to navigate this world where there's so many different messages, it's really, really tough. And people are making very serious health decisions, and they're wanting to trust everybody who's talking to them, and all these things. So I think you really have to pray for discernment and wisdom, and educate yourself. Like, you need information, you need to get an education, and you need to be able, in trying to attain that in that education, you need to be able to discern what's real and what seems real, and what doesn't seem real, because there's all kinds of, I can't even believe there was, for example, somebody on YouTube saying that honey heals diabetes. And I'm like, no, it does not. And all you need to know what's real really is a blood glucose monitor that's on your arm constantly. There's one called the Libre, which I really recommend everybody get, because that will tell you the true story of what you're tolerating. Some people tolerate certain foods and it doesn't change their blood sugar levels, and others don't. Like, I found that for me, steak raises my blood sugar, as for eggs and bacon keep it at like 75. Remarkable. So anyway, just something to think about. And then also, I spoke about that. I don't know if I talked about it actually. The Warburg effect is the idea that cancer cells thrive on glucose metabolism. They need lots of glucose. They use 400 times the amount of glucose that normal cells do. And so why not starve them out by not giving them glucose, right? Why not? I mean, you're going to have circulating glucose anyway, as I'm daily proof, because my blood sugar today was probably like 100 all day. But so that's, they're going to try to feed off that. But you can also be in ketosis because your body thrives on ketone bodies. And I know that ketosis has this negative idea attached to it because of just different things that have happened in the past. And then you have ketoacidosis, which is not good, and that's when you have diabetes and things are going south for you. But this is not the kind of ketosis I'm talking about. And so going back to the ketogenic diet as an adjunct to standard of care therapies, okay? So it applies to everybody, whether you're sick, whether you have chronic disease, whether you have diabetes, except for type 1 diabetes, okay? But type 2 diabetes, cardiovascular disease, all these things, because those are chronic states of elevated blood sugars and inflammation. And what happens is when you just get your blood sugars back under control, there's not that irritation reaching every cell of your body anymore from the circulating sugar. And and so your body has a chance to calm down and heal. And then the ketone bodies are healing. They heal any number of things. And so there's, let me tell you where I get my information from. So I really enjoy listening to these doctors. I have a list, a whole bunch of doctors that I love to listen to. I've been getting my education from them. And one of them is Dr. Naisha Winters. She does integrative oncology, and she's been a physician for, she said 30 years. And in the 1990s, she had got diagnosed with ovarian cancer, and it was really bad. And she stumbled upon fasting and how that made her cancer shrink, how she thinks there was a correlation between it shrinking and her fasting. And so she started looking at being a physician. She started looking into it more and more. And now that is one of her main therapies, I would say, as far as diet is concerned, because she does a lot of integrative things. She does, hyperbaric therapy, the usual, the yoga, the deep breathing, the meditating. I had a list. And a lot of other really amazing therapies. But as far as diet is concerned, she definitely tries to get her patients in a state of ketosis at different times. It has to be supervised medically, of course, but if you're here and you are interested in that, I think it's important to find a doctor who will either, refer you to a registered nutritionist who is